I try to focus on a lot of things like nutrition and health and prevention. And I think this is something that we can, really get our hands around and help to prevent. Flossing, those kinds of things. I mean, can you give us a little just general health prescription?
Obviously, prevention is key in periodontal disease. Mm-hmm. Most people, unfortunately, have gingivitis, and gingivitis is the precursor to periodontal disease. And gingivitis is just an increase in the amount of bacteria you have in your mouth, and that comes from, as for kids, and you can kind of see it in your mouth when you're not brushing really well and your teeth feel like they kind of have a fur carpet on them.
Right.
And your gums get a little red and puffy, and sometimes you notice they might bleed a little more easily. What happens is that bacteria in gingivitis can kind of get down to where you're underneath your gums, and that is actually that bacteria eats away at your bone, and then you have a deeper pocket, and the bacteria gets in deeper and eats more bone away until your teeth actually can eventually become loose. But prevention obviously is key. So good brushing twice a day with a toothpaste that contains fluoride is important. If some people have a fluoride sensitivity, and then there are toothpastes out there, Tom's of Maine, things like that with no fluoride that you can use. But we always recommend a fluoride toothpaste. And then, of course, there's no substitute for flossing. Guaranteed.
That's what we were talking about, because I don't like to floss.
I don't either, but I do it because I don't want to be a hypocrite. It's the only reason.
Exactly.
But, there is absolutely no substitute for flossing. I can guarantee if you start when you're 18 brushing twice a day and flossing once a day, I can guarantee you will never develop periodontal disease or gingivitis. Promise. But
it's a matter of doing it.
Yeah, you have to do it, unfortunately. And I tell people, I don't care what you put between your teeth. You could pull a piece of hair off your head and put it between your teeth.
Anything.
It's better than nothing.
It's better than nothing. Okay. What about the toothpicks? Is that traumatic, when you see people picking between the teeth? And
if done, if you're too aggressive with anything done in excess is obviously going to be detrimental. If you just use it to get food out from between your teeth or to stimulate your gums, it's not going to be a problem. I'd rather that than nothing.
Okay.
Water picks are also an alternative to flossing. I don't want anyone to think that there's an alternative to flossing, because there's no way around it. Flossing is best. However, water picks, dental picks, toothpicks used with caution are going to be better than not doing anything at all.
Than not doing anything at all. One of the reasons that I don't really like to do that, and because I've seen patients come in with like infection. Whenever you have a little bit of blood in the gum, it can get into the bloodstream, and I'm always cautious about that. Is there anything to do to prevent that, or?
Well, here's the thing. If you have infection in your mouth or bacteria in your mouth, even if you aren't bleeding, your gums aren't bleeding, that's still getting into your gum stream. So the best thing to do is to get rid of it, and the only way to get rid of it is brushing and flossing.
And that's why really it's important to get your teeth cleaned.
Right.
What is the recommended schedule for teeth cleaning?
If you have just healthy gums and teeth or mild gingivitis twice a year, once every 6 months is adequate. If you do have periodontal disease, unfortunately, you have that pocketing, and at this point in time we can't regrow bone, so you've lost bone. And so we say at least every 4 months, potentially every 3. We have some patients that need to come in every month, unfortunately, because they want to keep their teeth. That's few and far between, of course, but it's 2 times a year for normal healthy gums, up to 4 times a year if you have periodontal disease.
Okay, that's great. For our listeners out there, I just want to invite you to call in. This is an opportunity really to connect with a dentist and ask whatever, general dentist questions that you might have. 480-745-1033. I want you to tell us a little bit about your location, and I know that there's a special that you're offering just for people who call in and mention DocTalk Radio. Do you want to share that with us?
Sure. My office is Desert Springs Dental. It's right behind Gilbert Hospital off of Power Road, just south of Ray, north of Williams Field. And we're offering a special through the end of the year for anyone who calls in and mentions DocTalk Radio. We'll give them $200 off any treatment they have, and we always do free consultations and second opinions and things of that nature.
Excellent. That's great. And we'll mention that again in the show. Make sure that we post that.
Definitely.
There's other things like smoking. Can you talk about the correlation between smoking and dental disease?
There's a couple different things. First of all, cosmetically, smoking stains teeth, and I recommend if you smoke, I recommend a sonic toothbrush. There's several on the market. There's Sonicare, there's Oral-B, there's several sonic toothbrushes. And what that does is a traditional toothbrush, if you brush 2 minutes, which is the recommended time, you get about 3,000 brush strokes in 2 minutes. If you're using a sonic toothbrush in 2 minutes, you're getting about 30,000 brush strokes over the course of 2 minutes, and it's really going to help break up any staining you have.
Excellent.
The other problem with smoking is, unfortunately, increases periodontal disease. It seems everything does, but what happens is the smoking causes your blood vessels to constrict, so your gums don't get the oxygen and the nutrients they need, and they actually start to slough away and die away and cause other problems.
So from an intrinsic, mechanism, that's,
and
so it's
of
not
course
only,
we have oral cancer as well, which is another major
right, and that's not even to say chewing and those kinds
Right.
of things, really not good.
No.
Yeah, okay. I know we have a question, Joe.
We got a couple of them here already.
Sure.
Marilyn from Queen Creek says, every time I brush and floss, I bleed. Doesn't matter how often I do it. Every time I brush or floss, I bleed. Is there anything I can do? And I should have asked her if she was a smoker, if that would have come up. But
And there's a couple things. And actually, smokers tend to bleed less because those blood vessels are constricted. And so that doesn't necessarily mean there's not a problem, though. But the first thing, Marilyn, I would recommend is, hopefully, if you haven't had it checked by a dentist, have it checked by a dentist, because sometimes if you have periodontal disease and you've lost some bone, you can't brush and floss down to the point where the bacteria is. You can only get your toothbrush down so far in your gums, and so if you're not reaching the base of your pocket, you're leaving bacteria in there that's causing inflammation, and you will continue to bleed until it's cleaned out. And unfortunately, only professionally, you can get down the professionally.
And is it as easy as going in and having it, and I don't know if this is it, where they do the 1s and 2s and all that, they stick the little things in? Is that the test?
We take probe tests. We take 6 measurements per tooth, and it's basically like a golf game. You want a low score.
Very simple.
2s and 3s are good. 4s and 5s not so good.
Gotcha. Very simple to get tested.
Right.
So please go in and.
I want to make a comment about that. People who are on Coumadin, Plavix, aspirin, those kinds of things, do you make any recommendations for them in terms of their risk of bleeding?
Right. Honestly, for our initial exam and even for the deeper cleanings, we are fine with Coumadin, Plavix, aspirin therapies are completely fine. When we start to need to worry about that is when we need to do extractions. Then we need to consult with their primary care physician and make sure their levels are where they need to be prior to extractions.
Okay, that's good to know.
Then we've got Jamie from Phoenix, who is deathly afraid of needles and says, my dentist will not give me a root canal without needles. Is there a choice to be knocked out or get gas?
Both. You do have the choice. And the problem with that is you're probably going to need to go to a specialist, which is fine. But there are a few almost all, it's the root canal specialist is called an endodontist, and almost all endodontists offer gas. Unfortunately, with the gas, you're still going to need to have the needles, but you just don't really know you're getting them, and you don't care as much. But you're still getting them.
Exactly, and that's a good point. That brings us to talking about root canals. Could you just really explain to our listeners what is a root canal? We hear that a lot, and I really want to. I mean, I've had several, so I think I know what it is. But if you can explain,
I've had a few too.
Yeah, what it is.
Root canals have a really bad reputation because, unfortunately, people only talk about their bad root canals. I tell patients, the problem is no one goes out and says I've had the best root canal ever. No one ever goes out and says that. They keep those quiet. They talk about the ones that are terrible.
Exactly.
A root canal means basically the nerve of your tooth is either dead or infected, and so it's a very simple procedure. In all honesty, it's very similar. It's the same shot you would get if you had a filling. It's the same everything. So it's nothing extra. But what we have to do is make a small hole in the top of the tooth and then find all the nerves. And depending on what tooth you have, it can have anywhere from 1 to 5 nerves. And remove those nerves and then replace where the nerves were with a synthetic biocompatible plastic material that fills in the nerves. And then the tooth will no longer have any sensation. So really, it's no worse than a filling. What happens when people have bad root canals, it's because they wait a little too long, unfortunately, and they're infected. And when you're that infected, it's very, very difficult to get you 100% numb. And then you start to feel things. If we get it taken care of before it gets too bad, we can have you on antibiotics. You can feel pretty good beforehand. And it's honestly like getting a filling, and you feel it's actually a good thing because you feel so good when they're finished.
Right. That's good. That's good to know. And do you do root canals?
I do most. If it looks complicated or there's some other extenuating circumstance, I do have an endodontist I work with.
Okay. Now, you mentioned antibiotics, and I want to get to prophylaxis. We know that people who have had medical history, and we want to prevent an infection around the heart valve, endocarditis. Right. The recommendations have been previously that we take an antibiotic. there's some new recommendations now. Can you
and
share
they
that with
change
us?
so rapidly that it's hard for patients, and it's even hard for everybody
to keep track.
Dentists, we can keep track of it because it's directed towards us, so we're the first to get it. But the American Heart Association now has changed it. It used to be if you had mitral valve prolapse, if you had any type of regurgitation, if you had hip or joint replacement, if you had a heart attack, you needed to pre-medicate with antibiotics. It's now changed if you've had an artificial heart valve placed or any type of artificial valve placed, or if you've had a joint replacement within the past 6 months, we still recommend pre-medication, which is taking a dose of antibiotics 1 hour prior to dental treatment.
Okay.
We tell patients who've been taking it for a long time, we have a lot of patients that are still just more comfortable taking it because they've done it for so long, and that's fine. It's such a minimal dose of antibiotics, and it's not long-term, that there's really no harm in it if you're comfortable, but you definitely don't need to now unless you had an artificial valve or a joint replacement in 6 months.
Right. And they don't do it 6 hours after the procedure anymore.
1 hour before, and that's it.
And
now.
that's it. So people that have had rheumatic fever don't need to do
No.
that, mitral regurgitation, none of that.
Right, and the thinking behind it is that initially they were having you do it because of the bacteria that's in your mouth. They didn't want to get into your bloodstream.
Right.
But they're realizing now, just normal every day, you brush your teeth and you bleed a little. You eat and cut yourself with a potato chip, you bleed a little. And these people aren't developing endocarditis.
Exactly. So there's no increased risk.
Right.
Okay, that's good to know. Joe?
Leslie Santan Valley says she has a 4 and 6-year-old who have never been seen at a dentist. Is your office child friendly?
Our office is child friendly. TVs in every room.
Nice.
But and you know that Dr. Borik and I had talked earlier about kids, and we really recommend the American Academy of Pediatrics. I don't want to step on anyone's toes. Recommends children seeing a dentist for the first time at 18 months. But as a mom, I know and my children might be abnormal, but my kids were not fit to see a dentist at 18 months. So we usually recommend 3-4 first time for a first visit, unless you notice something in the mouth, a swelling or a dark spot on a tooth or something like that. But we also say, and not to get frustrated with your kids if they come in for the first time and really don't want to be there. Usually we say, just let them sit in the chair and go for a ride. Have the chair go up, go down, get a play with the water, get a play with the air.
Right.
You know, give them a cute, transformer, littlest pet shop toothbrush. Maybe let us brush their teeth. Maybe let them brush their teeth for us. And then have them come back. Because usually by 5, 6, we want to start being able to take x-rays. So if they've had a few good experiences before then, you know, they're usually pretty receptive by the time we actually need to do something. And what we also recommend with kids, I'd say 90% of kids who come to our office and get a shot don't know they got a shot. We prefer not to talk about it. We have enough distraction techniques that they can usually leave without ever knowing
Being traumatized.
they had a shot. So if we always recommend parents don't tell them,
Right.
not to be dishonest with them, but we can usually just eliminate that fear without.
And that makes sense. Yeah, that really makes sense.
Margie from Florence Gardens asks, maybe I misunderstood, but I do not floss very often, and now I'm having heart problems. Will it help my heart if I start flossing?
It can't hurt. I'm not sure. There's so many reasons for heart problems, but it definitely can't hurt.
And that's a great answer. You know, from a medical perspective, you know, I don't think that there's that it's going to reverse. You know, if you have coronary artery disease and the risk, and if you're diabetic on top of that, and you know, all of the other comorbidities, but it absolutely can't hurt. And I think that's really the message. You know, let's talk about diabetes and periodontal disease, because I think that's another big.
Unfortunately, it is.
It is. I mean, there's 30 million plus people with diabetes. It's an epidemic today. How does that tie into dental?
Unfortunately, 75% of people with type 2 diabetes have periodontal disease.
Wow, 75%.
Yes.
Wow.
And most of them don't know it, unfortunately. What happens is there's several factors. Again, it's an inflammatory process, but you have increased glucose in your saliva, and that glucose aids in the bacteria growth that causes periodontal disease. So you have it's
constant.
Right. And then
it feeds it.
Right. And then periodontal disease has been found to decrease metabolic control of diabetes. So it kind of is a two-way street. You get one and they start to interact with each other, and it's hard to control.
Right. It's a vicious cycle.
Right, it is. Exactly.
Wow. Is there a higher incidence of diabetics, you know, needing a full set of dentures, or has that been looked at? Do you know?
I'm not 100% sure on that, but I would have to say most likely, because people with periodontal disease have increased incidence of having teeth pulled.
Okay.
So fortunately now we're able to eliminate most full sets of dentures. Most people are able to maintain a few of their teeth, and we always say if you can save a couple teeth, even if it's only 2 to 4 teeth, you're quality of eating, chewing, speaking
better.
is going to be so much better. And so fortunately, we're able to do that in 90% of patients now.
Okay, that's good. You know, the question that always comes up in my own mind when I go to a dentist is the exposure of the x-ray.
Right.
You know, can you tell us what, you know, really what is the health danger to getting x-ray? You know, because it seems like every time you go in, you know, you have x-rays.
Right. You know, it's definitely it's starting to be minimized. Most dental offices now have digital x-ray. We have digital x-ray, and it decreases your exposure by 95%.
Excellent.
Once every 5 years, we need to do a full series of x-rays. It's a series of about 20 to 26 x-rays, and they liken that amount of x-rays to eating one piece of fish. So the actual radiation exposure is so low. Obstetricians now are telling us, go right ahead and take x-rays on your pregnant patients. We tend not to unless there's a problem, simply because, again, as a pregnant mom, you worry about those things.
Right.
So we don't do it unless we need to, unless there's an evident problem. But that's how low the
it's safe.
Yeah, it's very safe.
That's good. That's good.
We've got Russell from Tempe, 52 years old and single. He wanted to let you know. I was a heavy drug user in the 80s and 90s. My teeth are absolutely horrible. I'm embarrassed, so I haven't been to a dentist since 79. Where do I start?
Well, the first thing is, I guarantee you that every single dentist out there has seen worse. So don't ever,
there you go.
Yeah, so don't ever be embarrassed, because we're not out there. We don't judge you based on your teeth when you come in.
You see, when you say, I never even thought of that. I'm just thinking of the just really bad yellow and black teeth.
No.
But I guess you've seen it all.
Yeah, and you know, we've seen some pretty icky things, and unfortunately, drug use does eat away at the teeth quite a bit, and because for lots of different reasons. But the first thing is just go in, get a full set of x-rays, and figure out where to start. And you know, I would hate to find a dentist out there that would judge you on that, but the fact that you want to get it fixed, and that
Absolutely.
everyone deserves a good smile. That's the first thing people unfortunately see, and you need to be able to smile. And that's one thing I tell patients when we restore their smiles, they need to learn to talk again without putting their hands over their mouth, and learn to smile again. And it takes a while, but it's important.
Absolutely.
And Russell, we can help you with that 52 and single thing, but you need to go into the dentist and get this taken care of. Good time to give out your contact information, I think.
Right. Our office phone number is 480-279-3100, or you can reach us at desertspringsdental@gmail.com. We're also located at 5656 South Power Road, Suite 142 in Gilbert. We're right behind Gilbert Hospital off of Power Road, just south of Ray.
Excellent. You know, you're talking about a smile and teeth. Let's talk about bleaching,
Okay.
you know, the whitening, because that's kind of been a buzzword, and there's so many different whitening techniques and so forth out there.
Well, bleaching is kind of the fun part of my job. You know, people ask me a lot, what can I do to whiten my teeth? And there's so many different ways. There's a lot of the over-the-counter products, the white strips and things like that, and those do work. And what I tell people is the bleaching strips that you can buy at the store are a little bit more like a tanning bed. They'll fade. It'll fade over time. And what you have to be real careful with those is it's like a Band-Aid on your teeth. So if you don't get it pressed into all the nooks and crannies, you're going to end up with white fronts and yellow sides.
Got it.
So they do work. They're more for a quick fix. I say if you're going to have family pictures and you need, or you're going to a wedding and just want something for a night or two. Then we have a couple options. People, most people know the word Zoom, and it's the in-office whitening, and they call it laser whitening. It's not technically a laser. It's a ultraviolet light that shines on the teeth. And what that is it's 4 sessions, 15 minutes long, all at once, but 4 sessions of 15 minutes where a high concentration peroxide gel is painted on the teeth, and then this ultraviolet light is placed over that for 15 minutes and then rinsed off and then reapplied for an hour total. And you can lighten 6 to 12 shades in about an hour.
Wow.
No damage to the teeth.
That's
at
what I was
all.
going to ask
No
you.
damage.
Okay.
Basically, what we find, the contraindication to it is tooth sensitivity for 24 hours. It doesn't last past 24 hours, but it's basically your teeth are made up of millions of little tubules, and those tubules get blocked with foods and stains and smoke and just environmental pollutants and things like that. And so what that bleach is doing is kind of bubbling out those pores, and all of a sudden your teeth are fresh and clean again, and they're more sensitive to hot and cold for about 24 hours. And so that's a little bit. And you can also The light can also sunburn the gums a little, so we put vitamin E oil on them, and they regenerate just back in a day or two, but that's the downside. And then also bleaching trays, where you go into your dental office and we take a custom impression of your teeth, and we make trays that fit your mouth exactly, that you wear bleach in to whiten.
And then those ones you take home, and you can
take
continue
home.
to do that.
Right. And you can get exact same results with those as you do with Zoom, but you have to be very diligent about it, about 2 hours a day for about 2 to 3 weeks.
So it sounds like Zoom would be the best way to go.
It is. Of course, it's always a little bit more money than the other, but it's definitely the way to go.
And you do it right in your office?
Right.
Okay, that's really interesting. That's great. I know there's some more calls coming in, but let's talk a little bit about people who have osteoporosis, bone disease. I know that there was some research looking at people who take Fosamax and those kinds of medicines that really was contraindicated to have their teeth pulled. Can you talk a little bit about that?
Well, that's been changing recently.
Okay.
What the concern was people who were on these drugs for osteoporosis and some sorts of cancer were having teeth pulled, and then the bone where the teeth were pulled from was rotting away. It's called osteonecrosis, so it's kind of a rotting of the jawbone. And with further research, they're finding it happens mostly only in cancer patients who have received these drugs through IV.
Okay.
So it's still a concern for patients who are receiving bisphosphonates for cancer through IV. But really now with oral Fosamax and things of that nature, not a concern anymore.
Not a concern anymore.
Right.
Wow, that's good. Pet care. I have to ask you this because I have a little puppy and my little dog. Is there anything that we should do for our pets, for our dogs, and to maximize their dental care? I know you're not a pet dentist, but
I have a dog though, and I don't brush his teeth as well as I should.
Because I know that they have these little toothbrush for dogs and so forth. I mean, should we be brushing our pets' teeth?
I think we would all save a lot of money and save our pets some pain down the road if we did brush their teeth regularly, because pets develop periodontal disease too, and that's why a lot of pets have their teeth pulled. And dental cleanings at a veterinarian are expensive.
They are.
But
right.
if we can get their teeth cleaned at home, they'll probably still need to see a vet for cleaning
could
every
you
once in a while.
use regular toothpaste?
Yes, you can. They might not like it though.
Okay.
I do know that they have bacon flavored toothpaste and chicken flavored toothpaste and stuff for dogs.
Okay, but so the fluoride isn't. I mean, it's not contraindicated.
No,
in
not
them at all.
contraindicated in pets, as far as I've been told.
Okay, that's good. That's really good to know.
We got an alternative question to the doggy issue here.
Yes.
Okay.
Annie in Scottsdale says, my dentist says kissing my dog is bad for my teeth and gums. I'm a dog lover and will never stop kissing my dogs. Is this true?
It is true that bacteria is transmitted through saliva, and so kissing can transmit bacteria. What they're finding, though, is it's more prevalent, and so I don't know about dog to pet owner, but with children and their mothers are the most common link that they'll have the same bacteria in their mouth. So if a mother has a high incidence of periodontal disease and the bacteria that's prevalent in periodontal disease, there's a high likelihood that her child's mouth already is predisposed to that bacteria, and it can be transmitted through kissing. You're not going to get periodontal disease by kissing someone who has periodontal disease or a dog that has periodontal disease, but that bacteria is transmitted.
Okay, and that makes sense.
Yeah.
Yeah, I mean that.
Meredith from Gilbert says, I had a black tooth from an accident, a front tooth. Had it fixed, and it's always been a tad loose. There's also a black line around the tooth where people can tell it's a false tooth. Is there a way to correct these issues?
Yes. Well, first of all, we need to see it. But usually the black line that you see around the tooth is, up until about 5 years ago, a lot of crowns would have metal placed underneath them. Now we're tending to do all porcelain, so you don't see these issues anymore, but that metal shines through at the thinnest part of the crown, which is right up by their gums, and so it shines through as a black line. And so if you see people with black lines around their gum, what you're seeing is the metal from their crowns. As far as the loose issue, there can be several things going on. It can be the bite is not quite right. It can be, there can be periodontal issues, several things like that, but it'd be changing the crown to make it not metal underneath.
Okay. Do you do braces? Is that?
I do Invisalign, which is the clear braces, the trays, and then I use an orthodontist for traditional brackets.
Okay. Can you just talk a little bit about the indications for braces? And
Sure. There's lots of indications. What we're finding now is more and more adults are doing braces. I actually got my braces off when I turned 39. I got them on when I was 36 and got them off when I was 39. So more and more adults are doing them. There's lots of reasons. First and foremost, the reason people do them is cosmetic.
Okay.
That's not even the really important reason. The really important reason is if you have a lot of crowding, you're not keeping those areas quite as clean, and we find those areas decay more, and you can't keep them clean. You lose bone again. Everything kind of comes back to losing the bone that holds your teeth in. You kind of have not a firm foundation. So that's the main indication. And sometimes too, when you have crowding, your bite is off, or if you have spacing, your bite is off. And if you bang certain teeth over and over again for years and years, you're going to wear those teeth down and have problems with them. So that's the real health reason for having braces. Of course, there's the cosmetic reasons. And as far as kids go, it's get them fixed early and you're good to go.
So that, and it covers everything.
Right. It covers a lot of self-esteem issues too, unfortunately, with teeth.
Absolutely. Implants, I think, is a big, is something now that people have their teeth extracted, and there's the implants. Can you talk about that?
Sure. Implants are basically the next best thing to your real teeth. Real teeth are the best thing, and then implants are next.
Okay.
Downside to implants is they're still pretty expensive. Without insurance, they're about $3,000, but still they're the best. They're the best thing out there. What it is, if you've had a tooth pulled, it's a titanium post that's placed in basically where you've healed from where your tooth is gone, or in the actual extraction spot of that tooth. And it has to be put in your jaw, and it has to heal for 4 to 6 months, depending on where it's at, because the bone actually has to integrate into it, so it becomes like a root of the tooth again. And once that implant's in and is integrated and is in there nice and firm and strong, we can put a crown on the top of it that looks just like a real tooth, and good to go.
Good to go. And really, then you never really have a problem with that. Or do they get infected?
Well,
or is there
no,
a
it can't
high
get
risk?
infected, can't get decay.
Okay.
But still need to be cleaned because unfortunately the bone can deteriorate again. So as long as we keep the bone healthy and clean, good, everything should be fine.
That's good. That's that's some really, really great information. It sounds like he has a call coming. Let's just give it a second.
Okay.
Joe, you have some questions there?
Okay. Let's see. Alan Phoenix. I drink diet soda, also coffee. Is it a staining problem only, or are they actually bad for oral health?
Staining mostly. Not so. The coffee definitely not bad. The soda is a little bit acidic, even though it's diet. But as long as you're, drinking diet soda, you're better off without the sugars. I don't really worry about it too much other than staining.
That's good. That's a good. Anything else? You there?
Sugared
Not from Alan.
Yeah, sugared sodas are a completely different story, though. The sugared sodas between the high fructose syrup, corn syrup, and then the acid in them, we find a lot of decay along the gum lines in kids who drink a lot of soda during the day.
There's some gum now, like the gum now that is beneficial for the teeth. Can you comment on the different types of gum?
Well,
chewing gum and those kinds of things.
There's a bunch of different gums, and a lot of them have a lot of different artificial sweeteners in them now. And some, I want to say it's called Xylodent. I'm not sure, Xylodent. But what they do is they increase saliva flow, and increased saliva flow decreases decay. So that's what it's doing.
Which
it's
makes
actually
sense.
Right. It's actually just
Right.
increasing your saliva flow.
So, there's something out there that we see called dry eye, dry mouth, Sika syndrome, that kind of thing. How do you treat that? Is there anything, because we recommend, people getting lemon drops to increase saliva. Is there anything else out that's recommended?
There's a product called Biotene, Biotene, and they have a toothpaste, a mouth rinse, and then they actually have saliva drops that it's like a oral lubricant. You put a couple of drops on your tongue, and it keeps you moist, because unfortunately in people with autoimmune disorders who have dry eyes, dry mouth, people who are cancer patients unfortunately get that dry mouth, we see rampant decay with dry mouth. So it's really important we keep the oral environment moist.
Right. You need something there?
We've got another question whenever.
Okay, yeah, go ahead.
Jules from Juneau, Alaska.
All right.
I eat a lot of ice. It's a coincidence that I'm in Juneau, Alaska. My dentist says it will crack my teeth. How is that possible, being ice is softer than teeth? Is it bad to do?
Well, chewing ice is contraindicated. I'm an ice chewer too. In Arizona, it makes a little bit more sense, though.
It's true.
The reason it'll crack teeth, it cracks teeth more readily if you already have restorations in. So if you have any kind of filling in your tooth, the tooth is already weakened with small crack lines you can't see. So chewing on ice can propagate those cracks, and eventually over time you'll have a piece of tooth break off. What we find is when teeth break, usually the fillings stay in the teeth and don't break, but the tooth breaks away from the filling, and it's because the tooth has been weakened around the filling. And so that's what chewing ice or anything else hard like that does. It just makes those cracks propagate slowly over time, and sure enough, one time you'll bite down and it'll be gone. Healthy teeth, though, probably can tolerate ice chewing fairly well.
What about citrus? I just want to kind of talk a little bit about different foods that we eat. People that eat a lot of lemons and those kinds of things, is that detrimental to the tooth?
We don't find it too much. What we find in a little bit of an older population is that people used to suck on lemons and just kind of have them right over their smile.
Right.
And there we'll find a lot of erosion of the enamel, usually not to the point where it's into a painful part of the tooth, but the enamel will have eroded and becomes a little bit of a cosmetic issue.
Right. Okay.
So if you just eat citrus, a lot of citrus, not a problem. It's the actual placing of the citrus directly on the teeth and leaving it there for extended periods of time.
Okay. Mouth guards. We take care of like TMJ, for example.
Right.
And I that's probably something, that you take care of, because I would refer back to the dentist for people that have, temporomandibular joint dysfunction.
Right.
Anything that we can let our listeners know in terms of wearing the mouth guard, how to protect the tooth, anything, about that?
Mouth guards can be for a variety of reasons, but for temporomandibular joint disorder, what the mouth guard does, and the reason it's so important to wear it, is your joint and muscles kind of tighten up over time, and that the mouth guard acts as a splint, and it forces your teeth apart and forces those muscles to relax, which then over time will then cause your temporomandibular joint to feel better.
Right.
So that's but constant wear is pretty much required. It's pretty rigorous.
Is that dangerous to the teeth at all, though?
If you wore it it's not dangerous to teeth unless you wear it 24/7 for like a year. Your teeth, when you take the mouth guard out after a year, would not come together anymore.
Okay. Oh, wow.
So, it's one of those things you need probably have an hour or two of rest from it a day. But
just to give our listeners, the TMJ, if you want to explain, a little bit about that, stress brings it on, some of the other things that that cause it.
Lots of things can bring it on, and some people are more susceptible to it than others. Basically, stress, clenching your teeth, grinding your teeth, an injury to the jaw, a blow to the jaw, so many things can bring it on. But we find, unfortunately, in this day and age, it's mostly stress related.
Right.
Those muscles just tighten up like any other muscle in your body and pull so tightly on that jaw
and
that
it's painful, right at the side of
right in the side, right below your ear almost, and it can become difficult. You have limited opening. Usually, you should be able to fit at least 3 fingers inside your mouth when you open, and people with TMJ sometimes can hardly fit 1 finger in.
Wow. Okay, so that's a problem. Question.
Yes, we have a question from a chatter out there that says, if you have one dark tooth, what's the solution for whitening? Is it possible to even out the shades of white?
It depends on the reason for the dark tooth. Lots of times if you have one dark tooth, it means that tooth is dead. And if that's the case and it's had some sort of treatment, you can do what we call internal bleaching, or we make a small hole in the back of the tooth, put a special type of bleach in and seal it up and let the tooth lighten from the inside.
That's a neat way.
But it depends on the reason why the tooth is darker. Usually if a tooth is darker, it's sustained some sort of injury and is actually probably dead. So if it's dead, then that we can do that. If it's alive, you probably wouldn't want us to do that.
Right, it would be painful then.
Yeah, we couldn't do it.
And I guess you would determine that before you make that recommendation. There's Rachel. I just want to, there's somebody that called in before the show, and before I forget, I want to wish Rachel a happy birthday. 43 years, so happy birthday, Rachel. Thank you for calling in. Foods, anything that you can think of that might be interesting, and just in general, in terms of what to avoid, for dental care, or what might be good, just in general.
Well, an apple a day is always good too for dentistry.
Okay.
Anything that's hard and crunchy is typically good to keep your teeth clean. We always say stay away. If you're going to eat something that would stain your white shirt and you would need bleach to take it out of your shirt, you probably don't want to put it on your teeth.
Okay, that's interesting. That's a good tip.
Yeah. So, we say avoid high sugary foods. What we find in a lot of children, unfortunately, and it's becoming less and less, is that they get put to bed with juices and milks instead of waters, and that's how we develop a lot of childhood dental issues, decay, and a lot of rotting baby teeth, because they're having those sugary liquids before they go to sleep.
That it's interesting that you say that, because in people now, we're in the flu season.
Right.
We're seeing so many people with upper respiratory infections and that kind of thing. You put a hose in your mouth, for example, and then you fall asleep with a cough drop in your mouth, and it kind of just sits right next to the tooth. Would it be wise to go with more of a sugar-free?
Anytime you have anything that's in your mouth for a long time, sugar-free gum, sugar-free mouth drops, sugar-free breath mints, always going to be better.
Is better. Okay. Just the artificial, sweetener is a lot of times people don't want to use that,
Right.
and that would be a kind of a reason why not to
Yeah,
use
and
it.
the best thing to do probably is to just, if you're going to have a cough drop, just have one with sugar. Just brush your teeth before you fall
Right.
asleep, and
Yeah,
you're fine.
and avoid that. Yeah, and avoid it. Yeah, that's good. What else do you think our listeners might be interested in hearing about, just in general? We use the word periodontal a lot. I don't know if you want to kind of bring a little bit more about what is periodontal disease, and is it gingivitis? Is it deeper than that?
Periodontal disease is deeper than gingivitis. Periodontal disease was once gingivitis, and basically it's bacteria in the mouth that has caused inflammation of your gums. And what happens is that bacteria actually cannibalizes your bone. It eats your bone away.
So it actually is disease of the bone.
Right.
Okay.
And what we find, and what the saddest thing to me is, sometimes we have people who will come in with have never had a cavity in their life,
Right.
but every single one of their teeth is loose, and we have to pull their teeth because their foundation is
Oh,
gone.
man.
It stinks. I know Joe's never had a
Now I'm
cavity.
scared. I'm like, wait a minute. I feel them loosening.
That's too funny.
Robert from San Diego, 65 years old, says, my teeth have really gotten small, like filed down. Is there help for this?
There is. It can be fairly extensive, and usually the first thing it involves is a mouth guard, because there's bruxing or clenching or grinding involved, and it's just wear over time. But there's usually a habit involved that he might not even be aware of, that's happening while he sleeps or when he works or does. It's usually a subconscious habit, because when you find yourself doing it, you stop. We find most people do it when they sleep, and those teeth wear down to really, really, really short. Treatment begins with some sort of mouth guard or splint to kind of get his jaw used to having his teeth apart again, because those teeth wear down so slowly over time. The jaw muscle gets used to being where it's at. And if you were to fix his teeth and make him normal sized again, he would develop TMJ, because his body wasn't used to having those teeth in that spot. So the first step is usually seeing a dentist, getting in some sort of splint or mouth guard so that your muscles can slowly over time acclimate to that new position, and then slowly restoring your teeth with crowns or fillings to kind of get them back up to their normal size again.
Okay, that's interesting.
A couple more questions. Okay, here we go. Alyssa from Gilbert. I have hepatitis. Does your office see patients with this type of disease?
We do. We see don't discriminate against anyone. Every single person is treated the same. We protect ourselves against every patient exactly the same. It's not.
Right.
I mean,
It's not-
that's quite responsible. I imagine some people probably wouldn't even tell you, would they?
Well,
Or would they? I mean, I don't know.
I'm sure some people don't. We have quite a few patients that have told us over the years, and I'd prefer to know. Just should something happen, should there be a needle stick, or one of my girls were to get cut or something like along those lines. But we don't really even think twice about it, because we use universal precautions, and
Exactly.
there's no. And like I said, we have patients from all walks of life and different reasons: blood transfusions, drug use. We have lots of different reasons people have hepatitis or other issues, and universal precautions. We're fine seeing whoever.
Yeah. Good.
Is flossing the best solution for receding gums?
It's part of the solution for receding gums. As we age, our gums tend to recede, even in healthy teeth. Flossing will help keep the gums stimulated. Also, rigorous healthy brushing is also important for receding gums. Unfortunately, sometimes gums will recede even with all the best dental and home care in the world. And for that, there's specialists that do grafting. I've actually had a gum graft. Sometimes they'll take a little bit of gum off the roof of your mouth and then graft it over those areas where your gums have receded. Sounds terrible, not too bad. I did it the day before Thanksgiving once and was fine for Thanksgiving dinner. So it
Oh, wow.
sounds worse than it is.
Wow.
But
Yes.
yeah, flossing is definitely part of the solution.
Mouth sores, I guess people don't realize that, as a dentist, you address those issues as well. Anything that our listeners might be interested to know, just in terms of inspection, what to look for? Do you see a lot of times discolorations or sores, and how is that treated?
We do, and lots of times there's lots of different things. First of all, anytime you look in your mouth and see something that you haven't seen before, either go see a dentist or watch it closely. And if it changes or moves or does anything within a month or so, you need to definitely see a dentist.
Right.
We are more concerned about red lesions than white lesions in the mouth. The general rule of thumb that those are usually the more cancerous lesions. Lots of different options. Usually we can take a look at it and tell you what it is. Sometimes it can be simply a mucus heel or a blood blister or kind of like a mole that has developed in your mouth. That's what it is 99% of the time. If it's an area we're concerned about, we can do brush biopsies in the office where we take a little stainless steel brush and brush off some of the tissue and send it into a lab for a diagnosis. If it's a little bit more than that and we can't figure it out or are more concerned or get an abnormal brush biopsy back, we'll send you to the oral surgeon and they can biopsy those areas. But definitely you don't want to let anything go in your mouth. Survival rates for oral cancer are improving, but they're still not great, so it's always best to catch things early versus
And the same
late.
with the tongue. You know, we see a fair amount of people who are on antibiotics and then develop different problems with the tongue and yeast infections and those kinds of things. Does that impact the dental care as well?
It can. We get thrush and we get a few other things in the mouth, but
it's something that we just treat, and it really, it's not something that I would send a patient to a dentist for. We basically treat it. But there's nothing else that you need to look at from a dental standpoint, I guess, is the question.
We also have a lot of people who get canker sores and things like that. And nowadays, we actually have a laser in our office that we can use to people who get canker sores regularly kind of can feel them coming on, that kind of tingle. And if they come in and we use the laser on that area, usually we can stop the outbreak before it even happens. And we found people who have developed the canker sores and just can't get rid of them. The laser actually just dries out the lesion and it tends to heal a lot faster too.
Okay, that's really good news because canker sores can be a real problem.
Yeah, and the people who get those cold sores all the time can be, and they always seem to come up at the worst time.
Yeah. Exactly. What do you recommend in terms of mouthwash? Is that something that you recommend, I guess, first of all?
I do. First of all, because it's an alternative to flossing. It doesn't replace flossing, but if you're not a great flosser, mouthwash helps.
Okay.
I prefer mouthwashes without alcohol, simply because the alcohol has a drying effect on the tissues, and we want to keep the tissues as moist as we can. One of my favorites, Listerine. Listerine has a lot of alcohol in it, so I didn't used to like Listerine. Listerine now has Listerine Zero, which has no alcohol, and Colgate has Colgate Total, which also has no alcohol. Both very good, over-the-counter, good for everybody kind of mouthwashes.
So there's another reason to use mouthwashes other than just for bad breath.
Right.
Right? While we're speaking of that, I know there's a question, but halitosis, is there anything else that we need to know about that? I mean, is there other issues that maybe need to be looked into if people that have chronic halitosis or...
Chronic halitosis is going to go right back to periodontal disease 90% of the time. Also, we recommend tongue scraping for halitosis because the taste buds on your tongue are taller than we think, and they can house a lot of bacteria. So we say if you have a problem with bad breath, we usually recommend brushing and then tongue scraping. You can usually find a tongue scraper in your toothbrush aisle at any of your drugstores or other stores, and scraping your tongue after you brush your teeth, and it kind of clears off that whole layer of dead cells and kind of gives you a fresh start.
That's a good
I'm going to try that on my dog this afternoon.
There you go.
Linda from Tempe says, I get constant mouth rot. I use a regular inhaler for asthma, and it's so painful. Any advice? Mouth rot.
Well, sometimes the steroids that they're inhaling can increase tooth decay, and if I'm not sure if she has some decay in her mouth, that some of those inhalers
She was explaining it to me. She said her skin starts to peel apart
inside her mouth.
Yes.
Okay, and that's probably from the steroids, and I would talk to her doctor about maybe changing her.
A couple of things. We recommend a spacer. So people that that have asthma or that have emphysema that use an inhaler, if you take the inhaler and think about it, if you put it right in your mouth, what's going to happen is that the aerosol is going to get stuck in your mouth. But if you spray it into a spacer and then inhale it, it gives it time to go directly down into the bronchial tubes, which is where you want it. Where you want it. The other thing that we recommend is mouthwash after the use of an inhaler. Rinse it with warm water or whatever, just to kind of get rid of the residue.
Right.
I don't know. Is that something that's recommended?
And we don't normally deal with the asthma part of it. So But anytime you need to rinse, warm salt water, just warm water, a mouthwash without alcohol is good. And what that tissue is just the tissue is just sloughing off and not causing any
Because of the steroid that's just
Right.
like sitting on the inner
Right.
lining of the mouth. Yeah. Yeah.
Let's see. I tend to use a firm toothbrush versus soft. Is there a danger in using a firm toothbrush?
We recommend soft. The firm toothbrushes feel better when you feel like you've gotten your teeth cleaner, but actually you're actually damaging the gums. The bristles are so stiff that they're actually causing small abrasions on the gums, and they can actually, we actually see some, we used to see it more, we used to call it more toothbrush abrasion, where you have little notches at the surfaces of your teeth.
Interesting.
We found now that it's actually caused more from clenching and grinding than toothbrushes, but it can contribute to that. It's always soft, we recommend. And if you don't feel like your teeth are getting clean enough with a soft, we always recommend then going to an electric toothbrush or a sonic toothbrush,
Right.
and you'll feel clean.
And remember, you said 30,000 brushes.
Per 2 minutes, right? Versus 3,000 to 5,000.
Wow.
Yeah.
Well, the first thing is make sure that you're brushing your teeth for 2 minutes, because
Yes.
I'm not sure that everybody does that.
No. And we tell kids, pick out your favorite song, whatever your favorite song is, Justin Bieber, Selena Gomez,
Right.
and start brushing at the beginning of the song and brush till the end of the song.
You know, interestingly enough, my toothbrush has a timer on it.
Yeah, and if you use
It's
a Sonic,
it's a Sonic, yeah.
If you use a Sonicare or an Oral-B or one of those toothbrushes, they do have a 2-minute timer on it. So
And then
that-
it throttles down to a slower speed.
Yep.
It's like, stop, you've already gone 30,000.
Yep.
That's, now, how often do you recommend changing toothbrushes?
Every 6 months at least. If you have a cold or the flu or someone in your family does, throw them out and get new ones. With sonic toothbrushes and electric toothbrushes, you can just change the heads, and I recommend changing those every 6 to 8 months. They tend to last a little longer because you're not having to work as hard to get your teeth clean.
Right, right.
But
You know, the other thing that I found, just in some of the DocTalk things that we post on Facebook and the different postings, one message that I remember is it's not good to leave your toothbrush out in the, just in your bathroom. Just, it should be put away because of bacteria and aerosol and those kinds of things, hairspray and,
Right.
and all of that. Is that true?
well,
or-
it is true. And if you think about a toothbrush, most people don't dry their toothbrush with a hairdryer when you're done. So it's a wet, moist, deep environment that just
Exactly.
is a great spot for bacteria to grow. So if you can kind of clean it off and then put it in a relatively
case.
clean spot, you're going to be better off. A lot of these toothbrushes now, a lot of the Sonicares and things like that actually have a brush sterilizer where you pop the head off after you're done brushing, put it in, and turn the sterilizer on, and you keep it in there till you're ready to brush. So you start with a sterile brush head every time you brush.
And that would make sense. I know there's a question. We see a fair amount of H. pylori, and I don't know. H. pylori is a bacteria that kind of sits in the system. There's an increased risk of ulcers, peptic ulcer disease, and gastroesophageal reflux, and all of that, even gastric cancer. And and I've always thought, well, people that have poor dentition, poor periodontal disease, have a higher incidence of H. pylori. And that's really just been an observational kind of study. People that I diagnose with H. pylori, in my mind, tend to have poor dentition. And I don't know, has any studies been done looking at that?
Well, I'm not sure about studies, to be honest with you, but I know that H. pylori is a bacteria that's very, very common in the mouth, and it's in increased
Interesting.
levels in people with periodontal disease.
Okay, so that would make sense. Then the patients that I see, just by observation, that they have very poor dentition.
Right. Makes
Yeah.
sense.
Yeah, that does make sense. I know. Do you believe we're almost out of time?
That went
It
fast.
really, really did go fast. I mean, this is some great information that I think we need to take and modify behavior. I think that's really the message.
Really, prevention is key.
It really is.
A lot of people are afraid of the dentist, unfortunately. And honestly, I was afraid of the dentist. My parents are amazed that I became a dentist because my dentist used to have to open his office early to see me because I was a screamer and he didn't want to scare the other patients away.
That is so funny. And
But-
here you are, a
I
dentist.
know. But really, it's gotten so much better. We now have electric drills. Still, people say they're silent. They're not silent, but they're so much more. They're so much quieter. The vibration's not quite as bad. We have better anesthetics, so you actually get numb and you're comfortable. And most offices now have TVs for you to watch while you're getting treatment, and there's music, and you can have your iPod, and
Right.
it's just so much better than it used to be. And like I said, don't ever not go because you're embarrassed, because we pretty much have seen it all.
Absolutely. It's the
And,
same,
yeah.
why, it would be like saying, well, I'm embarrassed to go to my doctor because I have I mean, it makes no sense.
Right, and
Yeah.
we can fix most anything, and there's lots of solutions to every problem for every budget. I mean, and so there's always something that can be done to help.
That's a good message. Yeah, Joe.
Let's see. We have Riley from Tucson who says, I only use toothpaste one time per week, but I brush quite a bit. I've always been under the impression that toothpaste takes away the enamel. True or false?
False. Most toothpastes now actually have something that actually recalcifies the enamel in it. So we recommend toothpaste use for lots of reasons. The fluoride is one. Two, it just really it's almost like shampoo. It really kind of bubbles and gets into all the nooks and crannies. So if your toothbrush isn't reaching everywhere in your mouth,
Right.
the toothpaste kind of flows and bubbles into some of the spots where you're missing. As long as you're using toothbrush that's approved by the ADA, which almost all toothpaste now are, a Crest, a Colgate, a Sensodyne, AIM, all those, you'll be fine. Your enamel will not deteriorate.
That's
using
good.
it.
So it really makes no sense to brush with just water.
In a pinch.
In a pinch, that would work,
Right.
right?
It's better than nothing. But really, you're not getting the full effects of brushing if you're not using toothpaste.
Okay.
It's like showering without soap. It might rinse you off, but it's not
Right.
quite getting you as clean.
Right.
Shema V from Nogales. I always brush with straight peroxide. I have very white teeth, but it does hurt a bit.
Yeah.
Good or bad?
Not recommended. I do have some patients that once a week or once or twice a week will brush with a little peroxide and baking soda, and they do tend to have nice teeth, so I'm not going to completely knock it, but I would recommend minimizing it to no more than once a week and to diluting your peroxide too, because it can damage your tissues a little bit. Not going to necessarily damage the teeth, but it will damage the tissues around the teeth.
Interesting. Very, very good. I want to just kind of bring things together. Why don't we mention again the special? Because just in case people came in a little late, I want to make sure that they get where you're located and what your special is.
We're basically offering $200 off of anything you need or have done, even just for your exam when you come in and mention DocTalk Radio, or if you mention it when you schedule your appointment. And we are at 5656 South Power Road, Suite 142 in Gilbert, right behind Gilbert Hospital. On Power Road, off of Power Road, just south of Ray. And our phone number is 480-279-3100.
Very good. Well, let's just kind of wrap up our conversation today, just to kind of recap. We talked about periodontal disease and the risk of coronary disease and diabetes. Are there any other medical conditions that are related to dental problems?
Actually, they're finding that mouths with a lot of bacteria, so unclean mouths, not necessarily even periodontal disease, but gingivitis can lead to low birth weight babies. So much so, in fact, that a lot of dental insurances are now switching to, most dental insurances will pay for 2 cleanings a year. Wow. A lot of dental insurances are now switching to, for pregnant women, 3 to 4 cleanings a year completely covered, even if they would normally have to pay.
That's
because
interesting.
Because of the link between low birth weight babies and bacteria in the mouth. So that's another interesting link between oral health and a whole different population of people.
What about Alzheimer's? And there's some talk about dementia and those kinds of things. Is there any link, as far as you know, with that, just with the inflammatory changes and the inflammation?
Not that I'm aware of. The problem we see with Alzheimer's patients, dementia patients, and stuff like that is a lot of their mobility and their dexterity and things of that nature is starting to decrease.
Right.
So their oral care is starting to decrease, and then we get an increased incidence of inflammation and increased incidence of problems and things of that nature.
And it's a vicious cycle.
Right.
Okay, good. Teeth pulled. Just one last topic that I want to talk about that we really didn't talk a whole lot about was pulling teeth. Tell us about the indications for that. I mean, you do it in your office, is that right?
We try to not pull teeth anymore. I mean, you can't replace them.
Right.
You can get implants, and like I said, implants are the next best thing to your own teeth, but they're still not your own teeth. But certain times there are indications for extracting teeth. Lots of times it's financial, and that's okay. If it needs to come out because that's the only option, then it needs to come out. If there's decay down to the nerve and you're in constant pain, and
or like a failed root canal,
failed root canal,
like
a fractured tooth down low below the bone and gums that we can't fix. Periodontal disease is an indication for extracting teeth often because the foundation has gone away and the teeth are loose. But really nowadays we try really hard to keep your teeth because we can't put them back in.
Right. And I guess the studies show that it's better to have teeth rather than the false teeth.
Right. Lots of nutrition is really important. People with false teeth tend to have decreased nutrition just because they can't taste their food. They tend not to chew it as well because it's more difficult to chew, so it's not digested as well. There's lots of indications for keeping your teeth.
That's interesting.
Somebody would like to know, what type of toothpaste do you use?
I use Colgate Total.
Here we go. Send us the check, Colgate.
That's right.
There you go. That's a great plug, huh?
I do use Colgate Total.
Joe, do you have any questions? We just have a minute, 2 minutes left. Anything else you want to add in?
I'm good.
You're like tooth educated now.
I'm very educated with
You
teeth.
know what? You really are. This is totally out of the realm of my practice. And so, this has been enlightening, and it's really good to have an opportunity to just ask these questions and get the information.
I guess I do have one question. And you said that you use the Invisalign braces, and that's what you use in your office. Are the old ones, are they just archaic and gone? Is there no reason to get those anymore?
No, they're still very, very, they're very
viable.
Needed. Yeah. Invisalign, you have to be very diligent, and you have to wear them. You have to wear them 22 hours a day for them to work. So you can have 2 hours off a day. So really for kids, I wouldn't recommend them for kids because, you go to high school, you take your Invisalign out, you put on your lunch tray, it gets thrown away. And it's a series of, anywhere from 10 to 30 aligners. And it's each replacement one is about $200. So you throw a couple of those away, you've... Mm-hmm. My kids, when my 9-year-old just got out of braces, and we went with traditional braces for him. I think it's still really indicated in children. The cost is about the same, traditional braces versus Invisalign, but I think in a lot of cases, traditional is going to be better, especially for kids.
That makes sense. Yeah, that makes sense. Well, that's good. Thank you so much for being here.
Thanks for having me.
This has been a very enlightening show, and we work. Our wellness center is right next door to yours. And I guarantee you'll be seeing me as a patient.
Okay, well, good. We can't wait.
I want to come in and get the Zoom thing. That sounds pretty cool. Next week, I'll be here. We're going to open up the lines. So if you have any questions, write them down through the week. Don't forget, log on to Facebook.com. Like us on the Facebook. We're really growing. In fact, we have over 3,000 plus friends and likes already. So we're really, it's fun.
Wow, right on.
Yeah, Joe, so thank you. We'll see you next week. This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.